Nigeria is now embracing new technologies to help save critically ill COVID-19 patients, especially those suffering from acute respiratory ailments, one of which is the continuous positive airway pressure, a treatment protocol that uses mild air pressure to keep one's breathing open. According to health experts, this oxygen helmet is addressing the shortage of ventilators in hospitals and is currently being used in 8 COVID-19 treatment centers. Well, let's now talk about how the delivery of health services has evolved during a pandemic. We're talking to Ifeanyi Osai, who is founder and CEO of CRIBMD. He joins us live via Skype from California. Mr. Osai, you run a doctor house call and telemedicine company. Talk us through how effective healing from a distance has been during the COVID-19 pandemic.
Healing from a distance has been very, very effective during the COVID-19 pandemic. Because as you know, in most hospitals and clinics that are operational in Nigeria, the beds are all full. A few weeks ago, beds at hospitals were going for 10 million naira a pop, right? So with CRIBMD or services like CRIBMD, you simply order a doctor home visit, or you can see a doctor through telemedicine. And this has really helped a lot in alleviating the crunch, the demand, the supply crunch in the country. So it has really been exceptional for us and for a lot of patients who are able to use CRIBMD. Our downloads and our usage has gone, over 5,000% in the last few months alone. So it's quite effective.
Just exactly how have you been able to deal with the limitation when it comes to taking the patient's temperature, X-ray, or even a blood sample for diagnosis?
Through our app, we have the ability to order a lab test. So we send you to a partner facility that specializes exclusively in being in a lab test. We can also send you a nurse to your home to do temperatures and blood draws and things like that. So oftentimes we will send a doctor along with a nurse to do that and take it to the lab and also give you the results digitally. So yes, we're able to do that.
Let's talk about telemedicine in Africa. It's expected, the market value is expected to hit some $40 billion this year. But it would appear that we have to get internet right first before this can fly.
True. So there are telco limitations in terms of the internet, but I think Nigeria has been, we are blessed enough that we operate, or our primary country is Nigeria. MTN, Glo, and the other local companies have been really good. So I think we've not had as much problem with it. But as we expand into other African countries, having that infrastructure in place will be key to being able to deliver solutions like this, like digital healthcare.
So precisely what would you recommend, especially now that we have some challenges with infrastructure and we also do not have enough medical personnel to reach out to the number of sick currently in the country? How exactly would you recommend that we go about this?
So I think the most important thing is to have a sit down, like companies like CRIBMD and all the medical association, to have a sit down with the telecom companies as well as key government officials, so we can talk about how we can help solve this problem, both from a private angle with investors and also from a government angle. Like if we all work together, we can help put better infrastructures in place to address these limitations.
Ifeanyi Osai is founder CEO CRIBMD. He joins us live from California. Thank you for talking to us.
Thank you.